I grew up in the Midwest in middle-class suburbs.
I was 13 or 14 years old the first time I tried drugs. Went through a barbiturate phase, an amphetamine phase.
I got a scholarship to go to college.
The entire year of 1976 was spent on some form of hallucinogenic.
I don't know how, or I got to the point that I was using heroin and then injecting it.
I'm going to do a little heroin. Well, it didn't end up being a little heroin.
We actually surveyed 1,700 Bridgeport residents and asked them what their leading health concern was, and in every neighborhood, from the wealthiest neighborhood to the poorest, drug abuse was the #1 issue.
Syringes are everywhere. They're in mansions, they're in housing projects, they're in that beautiful home with the white picket fence.
In one family, I literally saw the husband, the wife, the brother, and a child all die from HIV, all within a year of each other.
Every time that we take a contaminated syringe out of the community, we're reducing the chance that somebody new is going to get infected with HIV, and we're saving a tremendous amount of public money. There are few things in public health where clearly modest amounts of investment save tremendous amounts of money later on. When a person gets infected, the virus beats down their immune system, they need medication. The current best estimate of the lifetime costs of just providing medical treatment for HIV infection is about $488,000. A clean needle costs 10 cents, give or take a little.
Project Access is the only syringe exchange program in Newark. When we're talking access, we're talking not just access to syringes, we're talking access to healthcare, drug treatment, and other services that people desperately need.
Have you been tested for HIV recently?
Yes, I have.
And where at?
Here.
Here? Okay. Can you tell me what your results were?
All I'm good.
Negative?
All negative.
Okay, great.
For anybody who doesn't know Northampton, it's a vibrant middle-class community. People are shocked to hear that there's a syringe exchange program that's operating quietly downtown. Over 50% of the clients that we serve are under the age of 30. Many of them have jobs. Hi, Kari, how you doing?
Hi, my name is Kari. I'm calling with Tapestry Health. I have 2 clients who are looking for available beds, one female and one male.
The majority of the work that we do is helping people figure out what they're going to do about their drug problem.
My syringe exchange staff come into the office in the morning, and the first thing they do is the person pulls all the stuff that they need to give away. Cotton balls, the alcohol wipes, all of those pieces get put together into kits that then get loaded out into the van. They hop in, and then right behind them is the GBAP van.
GBAP became involved in syringe exchange in 2010. We own 2 vans, and this was a great way to partner with the health department because they did not have the resources to bring the clients to treatment.
I can't tell you how many times we hear stories of people who were 24, 48 hours away from having a bed somewhere, decided to do that last night of drug use, and passed away.
Because you know how we talked about you wanting to go to drug treatment?
Yep.
Kevin is here. You're going to go there. And
We are the opportunity, with the help of GBAP, to get people at their most darkest hour and get them there immediately.
You want
strapped in there.
The expansion of the syringe exchange programs in New York began in 1992.
There are many critics that are out there that would say that syringe exchange programs only increase the desire for someone to become hooked on substances. A clean syringe is not going to put that in someone's mind to say, I'm going to now start using drugs.
Supporting syringe exchange, making things more dangerous, it's kind of saying the same thing. If you give people access to condoms, they're going to have more sex. They're not going to have more sex. They're going to have the same amount of sex they were having. They're just going to have it safer. Chasing bad guys and being shot at seems like the most dangerous thing that could happen to you as a police officer, but I would gladly take my chances in a gunfight rather than sticking my fingers on syringes over and over again. It's just, it's too much of an unknown.
Between 88 and 92, my life spiraled down very fast. I ended up homeless. I was down on Avenue D and 4th Street. There was a vacant lot there then. Homeless in this vacant lot, I think to myself, you know, what would happen if I were to die today? And the first thought that came to me was no one would know. And the second thought that came to me was no one would care. There was only one place to go. And I remember walking over to the exchange, walking up to the guy who was in charge. His name was Alan, and I said, Alan, can I use the phone? And I explained to him that I wanted to go to detox, and he said, okay. 20 days later or 22 days later, I was clean. I was done.
You should be aware of all of the public health and medical and scientific authorities that officially support syringe exchange.
It's been a little over 20 years. The life I have today is incredible. I haven't had a drink. I haven't done any drugs. I do not have HIV.
We're not living in an incredibly prosperous time. For many local and state health departments, lifting the ban on the use of federal funds for syringe exchange is essential if they're going to be able to develop those programs.
Working with the young mother today has been especially rewarding for me.
The exchange changed my life forever. It was like jumping off the high board into the deep end of the water and knowing that I was going to be safe and knowing that I could swim. It saved my life.
I'm a mother of 2. Seeing as I went through exactly the same thing, to be able to provide that, to be able to identify with her feelings and what she's going through, and to be able to give her information and resources to change her life in a significant way. Whether or not it happens, it may not. She may not be ready, but today, she said she was. And to know how far I've come and that it worked for me makes me realize that it can work for someone else as well.